we're going to go round the table and ask everyone for their final take-home, the individual take-home from this Congress. And perhaps, John, we can start with you.
Well, actually, I think SERVE-HF reminds us of something that is fundamentally important in cardiology. There are many observational studies that suggest assisted ventilation is associated with a better outcome in patients with central sleep apnea. We've now done the randomized trial and got the opposite result. We must do randomized trials. That is the basis of our evidence in cardiology.
Sanjay?
Over 34,000 people came here to manage established cardiovascular disease. But the results from EuroSpire were disappointing, and I think we really need to focus hard on preventing cardiovascular disease.
Okay. Cecilia?
Well, for me, the possibility to treat hypertension with conventional drugs already available is the major take-home message. There aren't that many patients with resistant hypertension.
Okay. Marco?
My take-home is go radial. So now the guidelines give us...
It's in the guidelines?
Yes, class 1A indication for radial, because radial not only reduces vascular complication, bleeding complication, but now also mortality. So we really encourage all the centers that are taking care for patients with acute MI to switch from femoral to radial.
Okay. Victoria?
For me, I would highlight the increasing role of multimodality imaging in several heart diseases is also included in the the new guidelines that have been presented here, and also the possibility to give us the possibility to tailor the treatment of each patient.
Brian?
I think a constant theme for me was seeing all of this new innovation coming through and this discussion about the benefit versus risk. And it's not always clear-cut and it's very difficult to define, whilst at the same time we hear evidence of our inability to adequately deploy cheap, safe, effective treatments that we know work and do reduce cardiovascular disease.
Yep. Janina?
I'm fascinated by these new anti-hypercholesterolemia drugs. You know, I think that it is absolutely new field and that it can change secondary prevention and also primary prevention.
Okay. Genevieve?
Well, I think that Elizabeth Blackburn, our guest host, has opened our mind on the fact that the environmental factors may lead to premature aging. And it comes up with a proactive theory that maybe aging is a primary disease and cardiovascular disease is just a symptom of this.
So aging is modifiable?
Oh, we hope so. And yours?
Okay, I can't get away without one. So, I mean, for me, there's been huge advance in the last years in acute coronary disease. And what we're seeing is therapies that are very hard to demonstrate additional benefit. But actually, after the acute coronary syndrome, there's a really important ongoing risk of events, and we haven't tackled these well enough. So in closing, we want to highlight what's coming up next year.
Well, we're looking forward to seeing you in Rome for ESC Congress 2016.
Great. Thank you all.
So I'm looking forward to welcome you in Rome next year, 2016, where the world of cardiology will come together.